Welcome to Science Exposed, the show that takes your wait what moments
Uh-huh.
and turns them into aha epiphanies.
We've all been hearing about that black mold lately.
Oh yeah, is it going to take over our brains?
Well, maybe not, but today we're going even deeper.
Deeper than mold.
Way deeper. We're talking infectious diseases and psychiatric disorders.
Okay, so not just feeling a little foggy when you're sick.
Not even close. This is about infections that can actually trigger things like mood disorders, cognitive issues, even psychosis.
Wow, that's intense.
Yeah.
And I know a lot of you out there are really curious about this, especially after...
Everything we've been through the past few years.
Exactly. So let's break it down. The thing is, this link between infections and mental health has been observed for centuries.
But we're still unraveling the how and the why.
Right. It's like this hidden world of connections between tiny bugs in our brains.
And what's even crazier is that sometimes the effects can show up even decades after the infection.
Are you serious?
Yeah.
So you can have something lurking in your system, messing with your mind without even knowing it.
It's possible. Take syphilis, for example. That's a bacterial infection that can lead to some really serious psychiatric problems years down the line.
Syphilis, I thought that was like a historical disease.
It's definitely been around for a while, but it shows us that these infections can have a long-lasting impact.
It's not just a matter of getting sick and bouncing back. It's like a ticking time bomb in some cases.
And while syphilis might seem like something out of a history book, we see similar patterns with modern infections too, like HIV and COVID-19.
Okay, so let's talk about viruses. Everyone knows HIV attacks the immune system.
Right.
But how does that lead to psychiatric issues?
Well, one way is through neuroinflammation. Basically, the body's inflammatory response, which usually helps fight infection,
Right.
goes into overdrive in the brain, and that can disrupt neurotransmitters, leading to a whole cascade of effects.
So it's like the immune system is trying to fight the good fight, but it ends up causing collateral damage in the brain.
Exactly.
Mm.
And then you have some viruses like HIV that can actually cross the blood-brain barrier and infect the central nervous system directly.
Whoa, so not only do you have the immune system going haywire, but the virus is attacking the brain cells themselves.
It's a double whammy. And with COVID-19, we're seeing a similar pattern, although the long-term consequences are still being studied.
Yeah, we keep hearing about long COVID and how it affects people differently.
Right. Some people experience things like fatigue, brain fog, and mood swings long after the initial infection is gone.
It's like this lingering mental health shadow.
That's a good way to put it. And there's growing concern about a potential delayed pandemic of neurodegenerative and neuropsychiatric disorders stemming from COVID-19.
A delayed pandemic. That's a scary thought.
It is, and it highlights the need for more research in this area.
So we've got viruses on the list of potential culprits, but what about bacteria? Can they mess with our minds too?
Absolutely. Lyme disease is a perfect example.
Lyme disease, you mean the one you get from ticks?
That's right. And it can cause a whole range of psychiatric symptoms, including mood disorders, cognitive issues, and even psychosis.
Seriously, that's terrifying. Just dealing with the physical symptoms of Lyme disease is bad enough.
It is. And one of the challenges with Lyme is that diagnosing and treating the psychiatric symptoms can be really difficult.
So someone could be struggling with these really debilitating symptoms, but not even realize that Lyme disease is the root cause.
That's a major concern. And it highlights the need for greater awareness among healthcare professionals.
Okay, so we've got viruses and bacteria on the list of potential mind messers. Are there any other infectious agents we need to worry about?
Believe it or not, parasites and fungi can also play a role.
Parasites. Fungi. Now we're getting into science fiction territory.
It might sound far-fetched, but it's true. Take Toxoplasma gondii, for example. It's a parasite often found in cats.
Hold on, my cat could be messing with my mind.
Well, it's not quite that simple. But studies have linked Toxoplasma gondii to an increased risk of schizophrenia.
Okay, that is both fascinating and slightly disturbing. And then you have fungal infections like cryptococcal meningitis, which can cause a range of psychiatric symptoms, especially in people with weakened immune systems.
So it's not just the usual suspects like viruses and bacteria. It's a whole army of microscopic invaders that could potentially be impacting our mental health.
It's a complex world, and the more we understand about these connections, the better equipped we'll be to protect ourselves.
Well said. Before we move on, I want to remind everyone that Science Exposed is brought to you by Dr. Cameron Jones.
Don't forget to like, share, and subscribe to get more fascinating deep dives delivered right to your ears.
Now back to our microscopic invaders.
Yeah.
How do these infections actually hijack the mind? What's the science behind the symptoms?
Well, we've touched on a few mechanisms already, like neuroinflammation, where the body's immune response goes haywire in the brain.
Right, like the immune system accidentally attacking its own team.
Precisely. And then there's direct infection of the central nervous system, where certain pathogens, like some viruses, actually invade the brain itself.
So they're not just messing with brain chemistry from afar, they're setting up shop in the control center.
Exactly. And then there's this thing called the immunopsychiatric interface, which refers to the complex interplay between the immune system and the brain.
Okay, that sounds complicated.
It is, but basically it means that when the immune system is out of whack, it can have a huge impact on mental health.
So it's like a domino effect. Infection throws the immune system off balance, and then the brain takes the hit.
That's a great way to think about it. And understanding this complex interplay is crucial for developing more effective treatments for psychiatric disorders, especially those that might be triggered by infections.
Okay, so we've got neuroinflammation, direct brain invasion, and this whole immunopsychiatric interface thing. It's a lot to take in.
It is, but it's fascinating stuff.
Absolutely. So what does all of this mean for our listeners? If someone's experiencing mental health concerns, should they be worried that it might be linked to an infection?
That's a great question, and it's important to remember that distinguishing between primary psychiatric disorders and those triggered by infection can be tricky, even for healthcare professionals.
So what should people do if they're concerned?
The most important thing is to seek professional help if you're experiencing mental health concerns, especially if you've recently had an infection or have other risk factors.
Don't try to diagnose yourself. Talk to a doctor.
Exactly.
Great advice. Now let's take a break and come back to finish our exploration of this intriguing and important topic.
We'll pick up right where we left off in part 2 of this episode. Until then, stay curious. Welcome back to our deep dive into the fascinating world of infectious diseases and mental health.
Before the break, we were talking about all the different ways those tiny bugs can mess with our minds. You know, inflammation, direct brain invasion, that whole immunopsychiatric interface.
Right, all these complex mechanisms.
But it seems like for a long time, this connection between infections and mental health was kind of ignored. Why is that?
Well, for one thing, the symptoms can be so varied and nonspecific that it's easy to misdiagnose them as something else entirely. Plus, as we saw with syphilis, the effects can be delayed sometimes by years or even decades.
Right, so you might not connect the dots between a past infection and your current mental health struggles.
Exactly. And historically, there wasn't a lot of solid scientific evidence to back up this connection. But thankfully, that's changing rapidly.
That's good to hear. So what kind of research is being done now to better understand this link?
There's a lot of exciting stuff happening. Researchers are using advanced imaging techniques to study how infections affect brain structure and function. They're also looking at the role of genetics and something called the microbiome.
The microbiome. Isn't that like the trillions of bacteria that live in our gut? What does that have to do with mental health?
It turns out the microbiome plays a huge role in our overall health, including mental well-being. There's growing evidence that an unhealthy microbiome can contribute to inflammation and immune dysregulation, both of which we know are linked to psychiatric symptoms.
So it's like a chain reaction. Infection disrupts the microbiome. The microbiome throws the immune system off balance, and then the brain takes a hit.
Exactly. And it highlights how important it is to take care of our microbiome through things like a healthy diet, exercise, and avoiding unnecessary antibiotics.
Because those good gut bacteria are our friends.
They are.
Yeah.
Now, moving on to treatment, what can be done to help people who are struggling with these issues?
That's the big question.
Well, it depends. If there's an active infection, treating that is the first priority. But even after the infection is gone, there can be lingering psychiatric effects that need to be addressed.
So what are the treatment options for those lingering effects?
It often involves a combination of approaches, including medication therapy and lifestyle changes.
Can you break that down a bit?
Sure. So medication-wise, it really depends on the specific symptoms, but antidepressants, anti-anxiety meds, even antipsychotics might be prescribed.
And what role does therapy play?
Therapy is super important for addressing the emotional and psychological impact of these disorders. Cognitive behavioral therapy, or CBT, is often used to help people identify and change negative thought patterns and behaviors.
So it's not just about treating the biological aspect, but also addressing the mental and emotional toll.
Exactly. And then there are the lifestyle changes, things like getting enough sleep, eating a healthy diet, and finding healthy ways to manage stress.
It sounds like it's all about taking a holistic approach, looking at the whole person.
Absolutely. And it's important to remember there's no one-size-fits-all solution. Treatment plans need to be tailored to each individual.
What works for one person might not work for another.
Exactly. And patience is key. Recovery from these types of disorders can take time. It's a journey.
That's a good reminder. It's not always a quick fix.
No, it's not. But with the right support and treatment, people can find healing and reclaim their mental well-being.
That's encouraging to hear. And as research continues, we can hopefully develop even more effective treatments.
Definitely. Now, speaking of prevention, what can people do to lower their risk of developing these types of disorders in the first place?
That's a great question, because it's always better to prevent than to treat.
Absolutely. Preventing infections is key. Practicing good hygiene, getting vaccinated, taking precautions to avoid exposure. Those are the basics.
Good old-fashioned common sense.
Exactly. But beyond that, there are things you can do to support your overall health and build resilience, which can make you less susceptible to the negative effects of infections.
Like what?
Eating a healthy diet, getting regular exercise, finding healthy ways to manage stress, prioritizing sleep. All of these contribute to a strong foundation.
It's about building a strong body and a strong mind.
Precisely. And don't underestimate the power of social connection. Strong social support networks can really help buffer against stress and promote mental well-being.
It's amazing how interconnected everything is. Our physical health, our mental health, our social lives, our environment. It all plays a role.
It does. And understanding those connections is key to promoting overall well-being.
Now, before we wrap up this deep dive, I have to ask about something that's been on my mind. We've talked a lot about the negative ways infections can impact mental health. But is there any evidence that they could have positive effects too?
That's a fascinating question, and it's one that's gaining a lot of attention in the scientific community. There's a growing field of study called Psychobiotics, which is looking at how manipulating the microbiome might actually be used to treat mental health disorders.
Psychobiotics. That sounds like something straight out of a sci-fi movie.
It does, doesn't it? But it's real science. The idea is that by introducing beneficial bacteria into the gut, we might be able to improve brain function and reduce symptoms of things like anxiety and depression.
So you're saying we could potentially eat our way to better mental health?
Well, it's a bit more complicated than that. But the early research is promising. Studies have shown that certain probiotics can reduce anxiety and improve mood in healthy individuals. And there's growing evidence that psychobiotics could potentially play a role in treating more serious mental health conditions, too.
Wow. So maybe in the future, instead of prescribing antidepressants, doctors will be prescribing probiotics.
It's certainly a possibility. We need more research, of course. Yeah. But it's an exciting area of exploration that could revolutionize the way we think about and treat mental health.
It's mind-blowing to think that those tiny organisms in our gut could have such a big impact on our brains and our emotions.
It is. And it highlights just how much we still have to learn about the incredibly complex relationship between our bodies, our minds, and the world of microbes.
Well said. This has been a truly fascinating deep dive. We've explored the history, the science, the challenges, the potential for healing, and even enhancement through psychobiotics.
It's been a wild ride.
It has. And I think it's safe to say we've all learned a lot.
I agree. I hope our listeners will continue to explore this topic and stay informed about the latest research and developments.
Absolutely. Because as we've seen, the more we understand about these connections, the better equipped we'll be to protect our mental and physical well-being. And that's a wrap on another episode of Science Exposed, brought to you by Dr. Cameron Jones. Thanks for joining us on this deep dive. Be sure to like, share, and subscribe for more mind-blowing science. Until next time, keep exploring, keep questioning, and keep those brain cells firing. Welcome back to Science Exposed.
We're here for the final part of our deep dive into infectious diseases and mental health.
Before the break, we were talking about how taking care of our overall health can make us more resilient to those pesky microbes.
Right, building up those defenses.
So it's not just about physical resilience. It's about mental resilience, too.
Right, absolutely. Because life is full of challenges, and infections are just one of many things that can throw us off balance.
So true. How do we build that mental resilience, though? Is it like building muscle? Do we have to do mental push-ups or something?
Mental push-ups. I love that analogy. But seriously, building mental resilience is a lot like building physical resilience. It takes time, effort, and consistency.
Okay, so what are some of the mental resilience exercises we should be doing?
One of the most important is developing healthy coping mechanisms for stress. That could be anything from meditation to spending time in nature to talking to a therapist. It's about finding what works for you and making it a regular part of your routine.
Finding your stress-busting sweet spot.
Exactly. And don't underestimate the power of positive self-talk. The way we talk to ourselves can have a huge impact on our mental state.
Oh, yeah. We can be our own worst critics.
Right. So it's important to practice self-compassion and challenge those negative thoughts. Focus on your strengths, celebrate your accomplishments, and be kind to yourself, especially when you're going through a rough patch.
Easier said than done sometimes.
It definitely takes practice, but it's worth it. Now, before we wrap up, I wanted to touch on something pretty mind-blowing. We've been talking about all the negative ways infections can impact mental health, but is there any evidence that they could actually have positive effects, too?
That's a great question. It seems counterintuitive, but I've heard whispers about this.
It's a fascinating area of research. There's a growing field of study called Psychobiotics, which is looking at how manipulating the microbiome might actually be used to treat mental health disorders.
Psychobiotics, that sounds like something out of a sci-fi novel.
It does, doesn't it? But it's real science. The basic idea is that by introducing beneficial bacteria into the gut, we might be able to improve brain function and reduce symptoms of conditions like anxiety and depression.
So is it as simple as eating yogurt to cure the blues?
I wish it were that easy,
Oh.
but the early research is promising. Studies have shown that certain probiotics can reduce anxiety and improve mood in healthy individuals. And there's growing evidence suggesting that psychobiotics could potentially play a role in treating more serious mental health conditions, too.
Wow. So maybe in the future, instead of prescribing antidepressants, doctors will be prescribing probiotics.
It's certainly a possibility. Of course, we need more research, but it's an exciting area of exploration that could revolutionize the way we think about and treat mental health.
It's incredible to think that those tiny organisms in our gut could have such a profound impact on our brains and our emotions.
It is. And it just goes to show how much we still have to learn about the complex interplay between our bodies, our minds, and the microbial world.
Well said. This has been a truly fascinating deep dive. We've explored the dark side of infections and mental health, but we've also seen the potential for healing and maybe even enhancement through things like psychobiotics.
It's been a journey of discovery.
It really has. And I think it's safe to say we've all expanded our understanding of this complex topic.
I hope our listeners will continue to explore this topic and stay curious.
Absolutely. And if you want to learn more, there are tons of resources available online and in libraries. Do your own deep dive.
Exactly. Keep learning.
And that's a wrap on another episode of Science Exposed, brought to you by Dr. Cameron Jones. Thanks for joining us on this incredible journey into the world of infectious diseases and mental health. Be sure to like, share, and subscribe for more mind-blowing science. Until next time, keep exploring, keep questioning, and keep those brain cells firing.